Hello. Today the topic is going to be immobilizing a suspected arm fracture below the elbow and above the wrist. Some of the signs and symptoms of that is going to be swelling with the obvious deformity, with or without the obvious deformity, pain, redness, bruising from traumatic injuries, or even just IV site for medical transports, and you need to mobilize the arm for somebody that cannot control their arm movements, and you don't want the IV site to come out, become dislodged, or infiltrate, or if like they have a PICC line in that arm. Some of the equipment you will need is cardboard splint that I already have engineered, some medical tape, that's what we would call it. Roller gauze, very annoying. Open it. I don't want to do that no more. Triangle bandage. I will not be taping that across my arm because that is some really good tape. And I have hairy arms and a cutting utensil. A pair of trauma shears. That's what those are, trauma shears. First step is we're going to check for distal PMS, pulses, motor, and sensory. Check for pulses in the wrist, motor, make sure that all the fingers still work, and sensory if I can feel it. And as long as it is still working, you do not have to maneuver the arm in any way, shape, or form, but you always want to continuously support it because you don't want to have to put pressure on it as least as possible, and you want to make sure that you keep the elbow stationary because there are two bones there, and any movement can rotate them and cause even more damage. So hopefully you will have somebody else with you, like another partner, but mine ran away. So Steven's going to come in from behind me and grab this while I hold the arm still and place it here. You'll need some padding to go inside of the splint to fill in the voids. This one's got padding already in it. My arm's kind of wide, so that works out pretty good. You can take the roller gauze and use it to place inside of the hand to kind of keep it in a neutral position. This will go upside the back of the elbow and up the arm, preferably a little bit taller to help keep the arm stable. And tape around the cardboard, that way it keeps it closed and stable. Again, I'm not going to do that because I have a lot of hair on my arm, and that's some really good tape. Again, once you've got it secured and splinted, you want to check for distal PMS, pulses, motor, sensory. I can still feel everything, my fingers still move. Then you're going to take your triangle bandage. I've already got it opened up, even though I got a broken arm. Open it all the way out, tie you a little knot in the middle of it. I always point it towards the injured arm. Put my broken arm back in the sling. That little knot is going to create an elbow pocket full of sunshine. And you take the inside. I don't need that anymore. You go up around the neck. Around there. And then you will tie it. Find the other end. Right there, and that creates a nice little pocket. You got big arms, these are little triangle bandages. And it doesn't work too well. But they also come with little safety pins. And after you place the sling Again, you want to check for distal pulses, motor, and sensory. So each step of it is, you get your cardboard splint. This one was open and was not cut and folded. I told you it was really good tape. So it's just an open splint meant to be folded like such into a longer splint. You can cut them and make them folded up however you need. You can measure it out beforehand and then fold it. Make sure you always have the padded part in and no tape on it. Even for a smaller child, you can put it further down and have it come up a little bit further. Cut it down along the edges here. That way it'll go up the arm a little bit better than it did mine. Be even better. This is not just for the arm, you can use it for the leg, the arm, for a tib-fib fracture, for a small child, not an adult obviously. They make larger splints for that one. These roller galls are great for using them to keep the hand in a neutral position. Also, when your arm is in the splint, if you have any voids, you can open them up and pad them so the arm is not allowed to move freely. Or you can open it up and use it to secure the splint around the arm if you don't have any tape. It's hard to do that with one hand. When you open your triangle bandage, it comes out in a long string. All of this is done in preparation before you actually start putting it into place while you have your partner maintain stabilization. It comes out in the long triangle form. Take the small triangle portion, tighten a nice little knot. That is what creates the elbow pocket. Drape that in over, place the elbow in that pocket. Tighten it, tie it around the neck, and makes a perfect sling. You can take a second one if you're worried about it bouncing while moving. You can take a second one and tie it around their chest or abdomen. That way it keeps it from bouncing or swinging. After each movement, after each securing, always want to check for pulses, motor, and sensory. If there are none, you are allowed to, per your local protocol, depending, you can readjust, realign one time and one time only, just to try to get pulses back to the distal site, because you don't want to lose any blood flow to the hand, to the foot, or wherever you're trying to maintain blood flow to, whatever extremity you are using. So preferably, depending on what it is, what side it is, so if it was for the forearm, it would be more appropriate to attempt to pull it straight. consuming you. It would be very painful. You would obviously want to consider pain management. Hopefully prior to, obviously, if their vital signs will allow for it, but obviously if not prior to, immediately afterwards. Sorry, my table's falling apart. Always make sure you have on your appropriate PPE, gloves at bare minimum. If there is any kind of bleeding, always make sure you have bleeding control. Always make sure you reassess vital signs before and after each treatment that you do. Make sure that you have the proper equipment each time you are about to place somebody in a splint, and communicate appropriately between you and your partner at all times. And each point of any movement, you always need to reassess that arm. So not just before and after splint placement, before and after sling placement. Whenever you get them off of the ground onto the stretcher, you need to reassess it. From the stretcher to the truck, it doesn't hurt to recheck it. From the stretcher, from the truck to the hospital, it doesn't hurt to check it again. From the stretcher to the bed, you might as well you're sitting right there, just check it again. Because at any point in time, if that arm loses its pulses, it becomes a little bit more serious. It's no longer just a broken arm. It's now starting to lose oxygen flow to the hand or to the foot, whatever extremity has the damage to it. So always make sure and document every time that you do it, at what time you do it, and what the outcome and what you have noticed. And don't remember to forget everything you learned.